Hi, Jen. How are you doing today?
I'm good. How are you?
Good. Thanks for asking. Thanks for taking the time for meeting with me today. I just kind of wanted to see what's prevalent on your mind right now and see how I can help support you.
Sure. Yeah. Thank you. So I've been working with a client who recently disclosed to me that he had relapsed and that he doesn't want me to say anything in fear of losing his child. He's planning to re-engage in treatment, and he does have a history of opioid use. He's been in intervention court and is currently on probation.
Okay.
Um, One question that I did inquire with him was that during his use, if there was a sober caretaker, which he did report that there was. So as a mandated reporter, that made me feel a little more at ease. But again, this was all just recently disclosed. I haven't really processed it all lately, and my conversation was him was kind of short. He had to go, so we'll be talking probably, I think, in 2 more days, as far as, any other support that I can offer him.
Yeah, it sounds like you're a little concerned about this client and what they've recently disclosed, but I think you did a great job of asking questions and making sure that there was safety in place, such as that sober caretaker. At this time, what would you say is like your biggest concern with this client who relapsed?
I think the biggest concern is that he does have a child, and just thankfully this time around there was a sober caretaker, but in the future, I obviously can't guarantee that and just hope that, he'll see the importance of what could happen if he were to relapse. So I think that's really what's been on my mind lately to prepare, when I have another discussion with him.
Yeah, it sounds absolutely like that safety aspect is kind of like what's been on your mind about this case. And like you said, right now there's the sober caretaker. But, that concern for next time, and what if there isn't a sober caretaker and how we can plan to make sure that there is that sober parental figure there.
Yeah, yeah. Well, and two, just, if he's willing to kind of make a plan, or if maybe he has an urge, if he's going to use, where is the child, what does that look like I said earlier, he is on probation, so he could be looking at, jail time if he doesn't have a good plan in place.
Yeah, I think that that's a great plan is to, come up with a form of like a relapse prevention plan and, plan for safety. One, making sure that there is that sober caretaker, helping him, understand and identify triggers that he's having and like what coping skills he can use and just have a plan that's realistic, to keep him safe while also supporting and maintaining his autonomy. I think that that's huge.
Yeah, and at this time, I don't have any releases for probation or for his treatment. And I would be willing to be a part of his relapse treatment plan, whether it's with me or maybe I could be a part with his substance abuse provider, ensuring that we're both on the same team, just to honor his confidentiality if he would like me to be a part of that.
Yeah, that confidentiality piece is crucial. And I feel like, some provider collaboration would be great in this case to best wrap him in services and, make sure that he knows he's supportive. Um, and it sounds like you're abiding by the code of ethics by maintaining that confidentiality, right? Not talking to the probation, um, especially without that release. So it sounds like you're doing a lot to support him and you have a good plan of safety and what to do if this relapse does happen again. um, it sounds like he's well supported. Do you have any concerns for like the code of ethics?
Nothing at this time. Like I said, I'm just honoring his, his self-determination of, his entrust in me, his confidentiality. Um, I'm willing to work with him, support him on however, he wishes at this time. I just think like you mentioned, that safety piece and, hopefully he'll be willing to do a relapse prevention plan. So at least something that we can talk about and make a plan. He is willing to re-engage in substance use therapy, so that was positive to hear. And then just maybe working on, some coping skills and what the triggers are when, what's going on at that moment when he's getting those feelings and that urge to use and kind of exploring starting there. Um, Maybe engage trying to get him to do like some NA groups or just other groups with individuals that have gone through similar experiences that he has gone through.
Yeah, it sounds like you're doing a great job and you are really supporting him and maintaining his autonomy, but giving him the resources and the tools that he needs to navigate through this period of time. And again, respecting um, his confidentiality and just being a support that's validating and helping him get through this period of time. It seems like you're doing really well.
Yeah, I think this was helpful. So I feel like I have a little better plan to attack when I meet with him in a couple days, and I can definitely keep you updated on any progress.
Yeah, that sounds awesome. And thank you for taking the time to like meet with me and go through this together. And you created a really good plan to support him.
Yeah, thank you so much.
You're welcome. Have a good one. If you need anything, just let me know.
Thanks.